We all have stories that inspire us, that move us. Stories can move us individually, collectively, nationally, globally. I work in the area of precision health. Can we use storytelling to improve the equity in the area of human healthcare? So, precision health means that I use genetic information to understand precisely what somebody might come up with later in life and when in life they will have that. So it's about be able to predict what somebody will have as a disease in the future. So my day job looks like this, pretty much looking at these faceless, nameless, soulless strings of letters. I get excited looking at it. The nerdy, geeky part of me gets excited looking at it, but it's difficult to impart that excitement onto somebody who doesn't get excited by this, who doesn't understand this language. I get even more excited when I find a spelling error, when I spot a typo in the string of letters. I get more excited because that lets me figure out that that precise typo, I can tell the person who has it what they will come down with in the future as their disease or their problems in health. When I look at these strings of letters, these come from human patients. But very often, as the researcher, as the objective data driven researcher, I don't know them. They are just a number in a spreadsheet for me. I don't get to know them. And for good reasons, to protect their identity, to protect patient confidentiality, and also to remove any subjective bias from my way of interpreting of the data. For example, this particular typo, instead of a C, when you see a T, the precision health scientist in me can tell that somebody who has that typo with that sequence context will become blind later in life. I know that because I can read this language. So I found this typo about 20 years ago and was very excited. I published papers, I presented in conferences, I even won awards. I felt very accomplished until I met the human who had this typo in their DNA. So that woman was Ruksana. I met Ruksana in a clinic just by chance. I was visiting the clinic, visiting the doctor who worked with us, and then Ruksana was there at the clinic. And the doctor said, "You know, the mutation that you found, this is the person." So I met with her. She was blind, she was illiterate, so she could only hear the words, she could not see the results, which got me awards, which got me accomplishments. She was not educated, she was blind, but she had a vision more than me. She was more visionary than I was. She realized that if she could get us to their village, to her home, she can help her next generations who may or may not have the same spelling errors inherited from her. So we visited their house, we visited their village. She was blind because of a condition called glaucoma. You may have heard about the disease name. In glaucoma, what happens, you start losing vision from the side of your eyes. So if this is how a normal person sees, then somebody with glaucoma, their sight would start diminishing and it get like a tunnel and they become blind. So this is what Ruksana had. She was blind and many members of her family was blind as well. And with that information, me and the team visited their village. This is the real house where Ruksana lived in. So immediately the reality hit me. The objective data scientist in me realized that using their DNA information, using that typo, I won all the accomplishments, but I did not really do anything for them. I looked at the children who did not know they were carrying the mutation, they were playing around, who did not know their life will be robbed from them a few years from now. I knew. I could not do anything. That triggered something in me, and I started talking about them, but I could not breach patient confidentiality. I could not reveal their identity. I had to speak with the objective truth of the data. Let me tell you the actual reality that they face. This village, this house you are looking at, is 2 hours away from the nearest hospital. So think of a blind person who has to get the right bus, get down at the right bus stop, get to the clinic, find the doctor, and come back the same way home. So the result, they often didn't go for any checkup, right? Their able-bodied family members could accompany them, those who can see, but if they did, that means they lose that days of earning. So again, the result, they often didn't go. They missed the appointments. So which means it is a huge inequity in healthcare. Healthcare was not accessible to them, right? If they could get to the hospital, we could bring all the technology accessible to them, but they couldn't get to the hospital. So that became the challenge. And I started talking about it, but I talked from the objective data scientist point of view because I could not reveal their identity. So I kept struggling with this. And then I found a way. We made a film about her story. Ruksana is not her real name, and the lady you saw on the screen is not the real patient. She was an actor who played the role of the real patient in this movie. The movie is called The Vision of the Blind Lady. In this movie, we fictionalized the story, but the story remained real. We made a documentary fiction, docufiction. And in this story, I take you through my journey, my agony, as well as their agony, where as a geneticist, I knew who was going to be blind. I knew that if doctors could treat them before, they maybe their vision could be extended, or if we are lucky, can be saved. But doctors could not treat because medical ethics prevented them for treating before symptoms arise. This was a real problem, right? So this movie we made to portray our agony. I had no idea it will change something dramatically last year. To tell you what it changed, this is a scene from the movie. What you see here is Ruksana is agonizing over her eldest son, who was the only member in the family at that point who could see. She had two more children, younger than this boy, who are already losing sight. And we knew from our experiments that they indeed carried that typo. So they will become blind. So every single day, she would be petrified that this son will become blind and they will lose all sorts of earning and they will have no choice but to beg or starve to death. Using the genetic tools, using the precision health technology, we could tell her that this son did not inherit the typo from Ruksana and hence will not go blind for the same reason that other family members were. When we delivered this news to them, we personally went and delivered this news to them, she hugged me and she said they will be in their prayers every day from now on. That has remained the biggest award of my scientific career. But this movie has changed a lot of things for the last 6 months. I did not do it alone. There's a large team of very competent people who helped me deliver this story, deliver Ruksana's story to the world. After we launched this in May last year, a lot of things changed that I could not achieve in over a decade. Telling the same story, I just changed the way I told the story. I moved away from objective reality. I introduced the subjective, nuanced, messy life that we all have. What it did change? From August last year, 2023, until now, we have now operated on 3 children of this family, one doctor, one whole eye hospital, a large international charity taken up this cause forever, for as long as it takes to support this family. How? I told you that healthcare is not accessible to them. So this charity now brings transportation to them, brings them to this hospital. The genetic counselor counsels them, and then they consent to get the surgery. And the doctors perform surgery based on the information, genetic information that we provide. The result over the last 6 months is that these 3 children has been operated before they had the full-blown disease, before they lost their sight, and they are doing fine. We'll continue to follow them up, and if we are lucky, then we would be able to say that storytelling in precision health has changed lives of at least one family. So I did not stop because doctors said nothing can be done. I did not stop because objective storytelling could not get me where I was. I kept on telling the story and I found a way to tell a story different way. And that made Ruksana's story unstoppable. I urge all of you, if you work with data, put soul into the data, bring your data to life. You will be amazed by the result. Thank you very much.